Welcome to NAMP's monthly educational webinar series. I am your host, Andrea Granson, Education Program Specialist for the NAMP. Today's topic is the role of nitric oxide in cardiovascular health with Jay Wilkins, naturopathic doctor and founder of Bionox. These webinars are recorded and can be viewed at any time by logging into the NAMP members area where you can earn 1 continuing education credit. Okay, so let's get started. Jay Wilkins is a naturopath who has been in the health and wellness industry for 30 years. He operated a fully staffed wellness centre from 1993 until 2005 with a focus on electrodermal screening, homeopathy, functional medicine, energy medicine, massage therapy, detox programs, non-invasive health screenings, herbal remedies and nutrition. In 2005, he came across the 1998 Nobel Prize-winning research on nitric oxide nutrition. As a result, he sold his practice and began shouting from the rooftops the benefits of nitric oxide. He began teaching pulse wave analysis, a non-invasive vascular screening that indicates arterial constriction, congestion, stiffness, and blockage, and how, over time, specific nutrient oxide nutrients can cause a reversal. Since 2012, he has served as the Chief Medical Advisor for several GMP supplement manufacturers, assisting clients in creating safe and effective supplement formulas. Welcome, Jay. It's now over to you.
Thank you, Andrea. It is so good to be with you today. A little bit about myself. My background is in naturopathic medicine. I've been in the health and wellness field since 1993. I have been practicing since 93 to 2005, and that's when I really sold my practice and got more involved with the information that we're going to talk about in our presentation today. I became a trainer for pulse wave analysis, which we'll talk about a little bit later, a phenomenal non-invasive technology that can help you to see what your health status is today, make interventions, and then re-screen and see what kind of improvement you've made. Been involved in the whole nitric oxide nutraceutical movement since 2005. That's when I was first introduced to nitric oxide and nitric oxide precursors and nutrition, and worked with several different companies, was on the medical advisory board of several of these companies that featured nitric oxide supplementation, actually formulated products for several companies within the nitric oxide space. In 2012, I got involved in good manufacturing policy compliant manufacturers and have actually been the medical advisor for 4 of those different companies that are involved in manufacturing, and still consult today, helping customers formulate their products, making sure that they're safe and efficacious, and enjoy that role very much. And then in 2013 is when we launched our first nitric oxide nutraceutical supplement that we'll talk about, a formulation that has stood the test of time. Made a few tweaks to it, but very few. And this is where we get Bionox today. That's the name of my company, Bionox. It is a play, if you will, on, of course, bio meaning life, and nox meaning nitric oxide. So that is where we live, is really in that space, and super excited about the whole nitric oxide conversation. Definitely a nitric oxide enthusiast. Hopefully by the end of this presentation, you will be more enthusiastic as well. So let's get to it. Nitric oxide and cardiovascular health is the name of our presentation today, as when it comes to cardiovascular health, nitric oxide is key. So we'll see how that's the case. So what is nitric oxide? It's a very simple molecule. It's 1 part nitrogen, 1 part oxygen. It is made and utilized throughout your body. Primarily, it's created within your cardiovascular system, your endothelium involved, as well as you get precursors for nitric oxide through your diet, so through the digestive system, but also your nerve endings. It is a neurotransmitter, so it's a very ubiquitous molecule. There's well over 140,000 articles to date on nitric oxide and nitric oxide precursors. It was named Molecule of the Year in 1992. It has become the most researched molecule in history. You've got pharmaceutical companies grasping at how to harness this molecule, and there are very diverse pharmaceuticals that have been created from all sorts of different health conditions, trying to again harness this molecule and what it can do for the specific claims that they're wanting to make. Most of you, no doubt, would know about the little blue pill, where in 1998 this was created. It was supposed to have been a blood pressure medication. Did not work very well for reducing blood pressure, but the men in the study said it does work for another part of the body, and led to this whole class of erectile dysfunction medications, a billion-dollar business. And really things culminated in 1998 when the Nobel Prize in Medicine was given to these three gentlemen here. And it was for their discoveries concerning nitric oxide as a signaling molecule in the cardiovascular system. So it's had its roots and interest in the field of cardiovascular health. It's reached far beyond that, but we're definitely going to hit on the high points of how it relates to the cardiovascular system, as well as other health issues as well, and other parts of your body. So when it comes to cardiovascular health and having benefits, this is good news, because heart disease is the #1 cause of death in this country and in all developed countries. Some 600,000 die each year due to heart disease here in this country. Half are women. So as women especially get to those menopausal years, they equal what the statistics are for men. 60% of youths are at risk for heart disease. 70% of 12-year-olds already have fatty streaks developing within their arteries. Every 60 seconds, someone dies of a heart attack. The effects of heart disease is like 7 Boeing 747s crashing with no survivors every day. That really helps to put things into perspective on and how this disease is really, when it comes to this country, the next several causes of disease, cancer, and so on, do not equal what heart disease is. Well, what does it do? Well, the real question is, what does it not do? Because we mentioned cardiovascular disease and and how nitric oxide fits into that. We see this with regards to atherosclerosis, high blood pressure, diabetes, coronary artery disease, peripheral vascular disease. You name it, when it comes to cardiovascular health, enlarged heart, their nitric oxide plays a very key role in keeping every part of your cardiovascular system healthy. And we're going to dive into that even a little bit more. But it also has much to do with your immune system. One of the really frontline treatments for those with COVID is to administer nitric oxide gas straight. Why is this? Because it reduces inflammation. It helps to disable pathogens, viruses in particular. It has the ability to open up blood flow as well as breathing. So all the symptoms that are related to acute issues with COVID in hospitals, that could be administered, and it was great results were seen with patients that were given nitric oxide gas. So it also, nitric oxide is very important for disabling all sorts of pathogens. And again, we'll key in on that a little bit more. But as you see from this list, this is actually a paper that I have. It's 118 different studies on what nitric oxide can do. So yes, cardiovascular, absolutely. Immune system issues. But we also see when it comes to exercise, which again relates to circulation, we see all the things related to blood sugar types of issues, as nitric oxide helps for insulin sensitivity as well as for insulin production. But we see osteoporosis, we see various inflammatory issues like cystitis, prostatitis, just so many different things that nitric oxide is important to give attention to in dealing with individuals' health. We see another one that's big these days. People are very concerned with their brain health. So as we see towards the bottom of the list, Alzheimer's, as well as memory and cognitive function. So nitric oxide is something that your body makes, and that's what we believe is our body's best medicine, is what our own body creates. So if we can get our bodies to make our own hormones, that's the best hormones, is what our body makes. Our own antioxidants, glutathione, and such, those are our body's best medicine. Our own enzymes, those are the best. So nitric oxide is the same. Anything that we can do to facilitate our body's own production of nitric oxide is a good idea. Now, Dr. Stamler, who's a leading researcher of nitric oxide and its implications, at the time he was at Duke University, but this is his comment. It says, it does everything everywhere. You cannot name major cellular response or physiological effect in which nitric oxide is not implicated today. It's involved in complex behavioral changes in the airway relaxation, beating of the heart, dilation of blood vessels, regulation of intestinal movement, function of blood cells, the immune system, even the way fingers and arms move. So again, it does everything everywhere. Nitric oxide has been called the spark of life because when your father's sperm meets your mother's ovum, it lets out a little bit of nitric oxide to be able to penetrate, and conception takes place. So you have nitric oxide to thank for your very being here today. Now, these are a few books that I came in contact with back in 2005 that really changed my world and got me so excited about what nitric oxide can do. So one is The Cardiovascular Cure by Dr. John Cook. And he wrote this book, and really, as the book brings out, the cardiovascular cure is nitric oxide. No More Heart Disease, NO, a play on, again, on nitric oxide. No More Heart Disease by Dr. Ignarro, one of the Nobel Prize winners, and that was given the Nobel Prize for the discovery of the nitric oxide pathway. The arginine solution. We're going to get into arginine, but this is a very important nitric oxide precursor. This was written by Doctors Freed and Merrill. Excellent publications, still extremely relevant, and would encourage you to also check these out. So how does your body make nitric oxide? Well, there's various ways. Laughing, it's been called internal jogging because, and we know how good laughter is as a medicine. So it creates nitric oxide. Exercise creates nitric oxide. And one of the reasons why exercise is so important for us with regards to cardiovascular health and virtually all health issues. Dietary nitrates. We see a little silhouette of a beetroot there, and they are high in nitrates. We're also going to talk about other vegetables that are high in nitrates. Infrared or beamer waves, you may be familiar with pulse electromagnetic frequencies. These also help to create nitric oxide. A small amount of alcohol. We've heard about the French paradox and different things. So a small amount does create vasodilation. No doubt we've experienced before where you have some a wine and it creates a warming effect. That's because of the nitric oxide that's being produced, as well as arginine. Arginine is a semi-essential amino acid, meaning your body makes a certain amount of it, but then the rest you get from your diet, particularly protein sources. So what causes a decline in nitric oxide? Well, it's very important that we understand what does happen with each decade after our 20 years of age. We get a decrease in nitric oxide. At the point when we hit 40, we're generating about 50% of the nitric oxide that we did when we were 20. So age is the number one cause of a decline in nitric oxide. But then also genetics, ethnicity, diet, medications, stress, which of course causes oxidation, smoking, heavy metals, as well as infection, are all things that can creates and contributes to a decline in nitric oxide. So we see our visual there on the right. We have the slice of the artery. No doubt that's a nice, youthful person there. The extreme left there, it's a normal, healthy blood vessel. But what happens? As we mentioned, 12-year-olds even have an attack on their endothelium, the inner part of their artery, and fatty deposits are made as a way to try to support the blood vessel from the assault that's happening to it. Blood sugar issues is another issue. Dysglycemia wreaks havoc on the endothelium of the arteries. So those fatty streaks get in there, you get oxidized cholesterol. This creates infection and white foam cells, which start to create a pus underneath the one cell layer endothelium of the arteries, the inside of the arteries. You get calcification, you get inflammation, you get glycation, and all these things create this toxic mess underneath the endothelium, to the point where, as you see later on in the slide, you start to develop this vulnerable plaque. And by the way, this is the number one reason why people have heart attacks and strokes. It's not so much the calcified stable plaque, excuse me, as it is this vulnerable plaque. And what happens over time is that this narrowing of the blood vessel creates a vibration within the blood vessel. It knocks the cap off of the endothelium, and all this pus then spews up into the bloodstream. Your body compensates by making a thrombus or a clot, and now you have problems. If you already have narrowing in a carotid artery and a coronary artery, then you're going to have a problem. That clot's going to settle in that narrowed area. And of course, what happens in the heart, then it's a heart attack. It happens in the neck or the carotid or in the brain, that leads to a stroke. So we have a good visual here of the progression of what happens. But again, it all goes back to nitric oxide. As Dr. Van Oot said, you're only as old as your endothelium. So if your endothelium is healthy, then your cardiovascular system is going to be healthy. Just as Dr. John Cook mentions in his book, The Cardiovascular Cure, he talks about this endothelium. And when your endothelium is healthy, it's like Teflon. Everything just slides through it and it stays healthy. Where it becomes diseased or tacky or sticky, then it becomes more like Velcro and everything attaches to it. And again, this vulnerable plaque begins to grow and cause a narrowing and all the dangers that go along with it as far as cardiovascular events are concerned. So let's start with this arginine nitric oxide pathway. Again, your body makes a certain amount of arginine. We consume arginine from protein sources. Citrulline is another amino acid that fits within that arginine pathway. So what's necessary for arginine to convert into nitric oxide is the enzyme nitric oxide synthase, which is what the endothelium in your artery creates. So when you couple nitric oxide synthase with arginine, then you get a release of nitric oxide. What's one of the first things it does? Vasodilation. So I've not seen anything that has been as effective for creating and normalizing blood pressure as using arginine type precursors. But citrulline is also very important in that as well. As Dr. Ignarro relates in his book, No More Heart Disease, citrulline is like a turbocharging effect of arginine. It creates a recycling of arginine, and it converts into arginine actually a little bit later in this cycle here. And so you do have this delayed release of nitric oxide when you couple arginine and citrulline together. It's like a Batman and Robin type of a tandem. Arginine is like Batman, citrulline like Robin, to really create and sustain nitric oxide in the body. So here's just a comment from Dr. Ignarro, again, one of the Nobel Prize winners, from his book, No More Heart Disease. It says, L-arginine is a naturally produced protein building block called an amino acid. L-arginine enhances blood flow and improves the activity of the endothelial cells because it is converted to NO in the body. Although L-arginine is found in some foods, red meat, fish, chicken, beans, soy, and nuts, you cannot normally consume sufficient amounts in your diet from meals alone. So I will be recommending that you take L-arginine supplements each day. And I would echo that. It is something that is very useful and healthy to use each day. I've been using it since 2005 on a very regular basis, and believe the importance of doing that, and we'll continue to do that. So here's a really great visual. This was a study that was done in separate studies by Dr. Ignarro as well as Dr. Cook from Stanford there. He's the head of cardiovascular research at Stanford. And what we see in group one is rabbits that were given a high cholesterol diet, and they all developed plaquing around the aorta. And when they were given a regular rabbit diet after giving this high cholesterol diet, they kept their atherosclerosis. It didn't go away. But what they noticed is when they started using these nutraceutical interventions, they would get various degrees or benefits of regression. So group two, they were given L-arginine alone, and we see some results. Group three, they were given L-citrulline, and they got some results. Group four, we see arginine and citrulline together, and those were really nice results. But if we go all the way down to group seven, this is where these rabbits were given L-arginine, L-citrulline, along with the antioxidants, vitamin C and E. And that's when the greatest results were seen. So here's a perfect example of a synergistic effect of those four ingredients. Now, why is that? What's the importance of vitamin C and vitamin E? Well, again, L-arginine and L-citrulline are nitric oxide generators. They're precursors. But vitamin C and E are antioxidants that help to sustain the nitric oxide production, as well as helping it to last longer. It only lasts a second or so, but this helps to facilitate a longer benefit of the L-arginine and L-citrulline, because nitric oxide is very susceptible to free radical damage. And so by adding the antioxidants, we see a much improved results with the arginine and citrulline precursor. Now, Drs. Fried and Merrill, in their book, The Arginine Solution, they said, in the field of medicine and health, it is one of the revolutions of our time. The discovery of the amino acid arginine may be the magic bullet for the cardiovascular system. So important. I mean, cardiovascular issues are the number one cause. We know it's the cause of heart disease, but we think about it, many other health issues are a result of various organs and glands not getting the circulation that they need. And to have that interchange or exchange, we should say, of getting nutrients into the cell and getting toxins out. So very important thing to consider. An excellent reference is the book, The Arginine Solution. Now we're going to talk about some other, what I call nitric oxide superheroes. Some of you may be familiar with Julian Whitaker, especially if you have any age on you. You might recognize him. He came on the scene as early in the 80s and 90s. He was really involved in producing information and newsletters way before taking vitamins was cool. I would say he's one of the leaders or forefathers of functional medicine because of his early works in our field. But he states this in his publication. He says, inadequate production of NO increases arterial damage. There is a way, however, to break this vicious cycle. Arginine supplements have been shown to restore normal function in damaged arteries. Dr. Sherry Rogers, a very outspoken medical professional, she's a medical doctor, but really doesn't have a high regard for pharmaceutical medicines. But she says this in the book, The High Blood Pressure Hoax. Researchers have shown that not only does nitric oxide slow plaque growth and suppress arterial sclerosis from forming, but arginine has actually melted away plaque that already existed on artery walls. So we are not stuck with our plaque. There are things that can be done. Some of you may recognize this gentleman. We lost him a few months back. He is an integrative cardiologist, or was an integrative cardiologist, and was very vocal and involved in promoting nutrition as a result, as a way to be able to effectively deal with cardiovascular issues. So from his publication, we see this quote: L-arginine has value for the whole gamut of atherosclerosis, from early signs such as high blood pressure and erectile dysfunction to advanced cardiac events. We feel it offers promise for plaque stabilization. Remember our image we had earlier of the plaque spewing out, that soft, vulnerable plaque? Well, he's talking about how it helps to stabilize that from actually happening. And then, of course, reversal is what we're really after. It is inexpensive and non-toxic. We use it clinically for treating angina, high blood pressure, erectile dysfunction, and stubborn risk factors we can't otherwise improve. So we're not getting the results that we want to be able to get from their protocol that they're on, then let's give more of the arginine and see if we can't move these stubborn risk factors in a positive direction. And that's what he was seeing. Now, my favorite nitric oxide superhero by far is Dr. Joe Prendergast. We were able to serve on the same medical advisory board for a nutritional company back in 2005, and just a wonderful wealth. He also passed away, I think, in 2020 in his 80s. But what a story personally, as well as within his practice, as to what arginine is able to do. So we see the problem. 75% of diabetics die of heart attack and stroke because, as mentioned, high sugars in the blood just tear up the cardiovascular system. They destroy the endothelium. And so we see all these complications that diabetics have. And the amputation issues, the issues of blindness, of kidney issues, they all go back to what sugar does to the cardiovascular system and the arteries. So his story is this: he had a father who was someone who was affected by a stroke, I believe, in his 40s, and he hated to see what this stroke did to his father, who he had great respect for, and he knew that he had genetic potential for issues for his cardiovascular system, to the point that in his 30s, he actually went and saw a colleague of his and asked him to take a picture of his abdominal aorta. And what happened after getting the results is his friend put his x-rays on the light board and said, "Who's your cardiologist?" So he knew he was in trouble. He had dysfunction beginning and plaquing starting in his arteries in his 30s. And he knew in his heart of hearts that even though a medical professional, that something in nutrition and nature was going to be what was going to help him as well as his patients. So we fast forward a few years, and we have a colleague of Dr. Prendergast named Dr. Victor Zhao. Dr. Victor Zhao was the head of cardiovascular research at the time at Stanford, and he went on to be over all of medicine at Harvard at one time, so a brilliant doctor. But Dr. Zhao and Dr. Prendergast used to lecture together. Dr. Prendergast would lecture about the benefits of statin drugs for diabetic patients. Dr. Zhao would lecture about the benefits of statin drugs for cardiovascular heart patients. And Dr. Zhao, after one of their presentations, leans over to Dr. Prendergast and said, "You're going to love my new research that I'm doing. It is something that will help you. It's all natural." And of course, Dr. Prendergast is like, "Well, what is it? I want to start doing it." He says, "Well, I can't tell you because it's my research." And as you may know, a lot of practitioners or scientists, they steal each other's research. And it's a terrible thing, but it does happen. So anyways, Dr. Prendergast went to the internet and he found out what he was doing, and it had to do with arginine. So Dr. Prendergast went down to the local health food store and started taking arginine. And after some time of taking arginine, he went back to the same doctor that took his x-rays before of his abdominal aorta. Now it's some 30 years later. So Dr. Prendergast is now in his 60s. And this time when he's looking at his x-rays, he says, "What are you doing?" And I want to do it, because he had completely reversed his plaquing out of his arteries. So he was healthier as a 60-year-old than he was as a 30-year-old. Well, this was great news for him, but then it was also great news for his patient base. Dr. Prendergast used to send 250 patients a year prior to learning about arginine. So he's referring these patients out to 3 different cardiologists. And then after implementing arginine into his practice, he was only referring 1 per year to cardiologists. So as you can imagine, this got the attention of the cardiologists that he used to refer to the point that the 3 of them got together and decided to take Dr. Prendergast out to lunch and find out what the deal was. And so they thought they made him upset in some ways. And he said, "No," he says, "I'm using this arginine precursor. It's all about nitric oxide." He was excited, and they were not. They could care less about the whole arginine story. 2 of them closed their practices. 1 moved to another location from the Bay Area in California to Atlanta, where he could continue to do what he was trained to do, which is high-dollar surgeries and so on. They just weren't interested in this inexpensive way to be able to reverse cardiovascular disease. So a tremendous doctor, a real loss. He had an excellent bedside manner, wonderful man to listen to in his experience, and we're so grateful that he shared with us what he was able to do in his practice. In fact, the 25 plus years that Dr. Prendergast was using arginine in his practice, he did not have 1 patient to have a heart attack or stroke. Truly amazing. Now that's the arginine pathway and the benefits of it. And by the way, that arginine pathway is an excellent pathway. I've seen tremendous results with 50, 60, 70, 80, 90-year-olds. There's some folks out there, some doctors that say, "Oh, that arginine is not useful after 40 years of age." And I just could not disagree more with the results that I've seen with Dr. Prendergast, all these other practitioners that we mentioned. We're seeing phenomenal results. So that being said, another very viable pathway is the nitrate-nitrite nitric oxide pathway as well. And this is something that we get benefits from through our digestive system. So unlike the arginine pathway, nitric oxide is created in the circulatory system primarily through the arteries, through the endothelium. But nitrates and nitrites are created in your digestive system. However, there's a few things that are necessary to make sure that nitric oxide is taking place. One is you got to have the raw materials of those nitrates and nitrites. So here in our picture, we actually see a plate of arugula. By the way, arugula is higher in nitrates by weight than even beets. A lot of times people think of beets as far as a way to boost your nitrates, and that it is true. Beets do have nitrates, but arugula is even richer in nitrates than beets are. So what happens? You consume the arugula. It has the nitrates in there. As long as you have a good, healthy microbiome, oral microbiome, you are able to convert those nitrates into nitrites, and that's critical. So first of all, we'll stop and talk about the effects of mouthwash. Mouthwash, antiseptic mouthwash kills all of your microbiome. So if we can make any recommendation, that would be we would definitely recommend, and the research supports this, that mouthwash does create cardiovascular issues in of itself. They studied individuals that were using mouthwash, and they found that they had higher blood pressure. And when they came off the mouthwash and got their microbiome restored, then the blood pressure came down because of not being able to reduce these nitrates to nitrites. Now, that's the first step. But then once you swallow those converted nitrites and it hits your hydrochloric acid, that's where the nitric oxide is produced. And then you absorb that nitric oxide throughout your digestive system into your bloodstream. Here again, we see a problem with taking these proton pump inhibitors, these various acid neutralizers, because now if you don't have that hydrochloric acid necessary, then you also are not going to create nitric oxide. So assuming you got good oral microbiome, you got a good stomach acid production, you'll create a nice change in this nitric oxide. It'll get into your bloodstream. It'll do all the benefits that we talked about. And then you also have the ability to excrete some of those nitrates through your urine, but also you get a reabsorption of some of those nitrates into your saliva glands. And as you produce saliva, then you're again doing this whole process over, nitrates to nitrites, and creating nitric oxide. So you can actually consume nitrates, and there's a way with a saliva strip, which we'll talk about a little bit later. You're able to show that 2 hours later that you're still making nitric oxide. You can still have high nitrate values in your saliva. So Dr. Greger is an excellent resource. I would recommend subscribing to his YouTube channel, nutritionfacts.org, I believe is what it is. And he's very much a believer in consuming nitrates. Also, you can look at the benefits of the DASH diet, dietary approaches to stop hypertension. This is a diet that's a modified Mediterranean diet, very high in nitrates. In fact, if you follow this diet, you could be consuming as much as 1,500 milligrams of nitrates per day, and obviously very successful in helping to reduce and normalize blood pressure. So what would make the best nitric oxide boosting supplement? Well, you want to make sure you have arginine and citrulline. You know, we've talked about Batman and Robin, but you also want to have it in the right dosages and taking it at the right time. So we have found and have seen researched that at least 5 grams of arginine per day with at least 2 grams of citrulline per day creates the best effect. And you want to divide those amounts to take them at 12-hour intervals. So you take half of that recommended dose in the morning, and you'll get a sustained nitric oxide benefit as we mentioned with some of the other precursors and antioxidants and such. You get a nice 24-hour release, and then you take it again 24 or 12 hours later, and you can create nitric oxide while you sleep and get good, restorative, healthy sleep that way by creating nitric oxide even in your sleep. We also believe that, again, consuming those nitrates from beets and arugula and other things are important to do. And as we saw from our slide earlier, we want to have antioxidants, vitamin C, vitamin D3, vitamin E, pomegranate, camu berry, grape seed, and grape skin extract are all excellent vitamin and whole food antioxidants. In fact, vitamin D3, there's plenty of research that show 5,000 IUs per day for a healthy individual, even more for somebody who's dealing with health challenges is a good idea, along with vitamin K2, 180 micrograms per day as a minimum for that. You want to make sure you have a balanced pH. Minerals are very helpful in this regard. Most people have a tendency to be acidic, and so minerals help to raise pH, which is also important for nitric oxide production and sustaining it. You also want to have a nice, healthy, Teflon-like endothelium. What helps to support that? Well, hawthorn berry, green coffee, horse chestnut, and Indian gooseberry, as well as all the other nitric oxide precursors and antioxidants help support that. And then you're not just what you eat, but what you are able to digest and metabolize. So we believe in a absorption complex called estrogen, which is part astragalus and part ginseng, and very helpful in Chinese medicine for heating up the digestive system. So estrogen is actually studied for its benefits for increasing the absorption of nutrients, particularly amino acids like arginine. So we see a little picture there. Basically what it's doing is increasing transporter cells. So those are what latch on to nutrients and help pull them through the small intestine and get absorbed by the villi there and into the bloodstream. In fact, with arginine, there's a 67% increase in absorption of arginine as compared to taking nutrients without the estrogen complex. So this is our mission statement. The mission of Bionox is to provide powerful, clean, all-natural, therapeutic strength, health and fitness supplements supercharged with active ingredients that promote and support peak performance, improved health, energy, strength, and endurance, and that make our customers feel better every day. So primarily, I got involved in this for its benefit for those that have chronic issues, and we see great results. But what we found is that our customers mostly are individuals that are very health minded. So they're going to the gym, they're active, and they also want to do things that are going to be proactive for their health or help them with even some of their minor things. So it really helps the whole gamut of those that either they're just looking for better fitness outcomes or they have a minor health challenge to those who have chronic issues. So here is our flagship product that has all those nutrients that we talked about as to what makes the best nitric oxide performing product. And so it comes in both a natural berry burst flavor and a natural citrus splash flavor. So these taste very good, all naturally sweetened and flavored, but it has your amino acid and your whole food nitric oxide precursors. So we use an arginine AKG, alpha ketoglutarate, which we have found to be even better absorbed than, let's say, arginine hydrochloride or elemental arginine, along with the whole food benefits of beet, pomegranate, and watermelon. So we do have some nitrate value as well. And then we see the antioxidant benefits from the C, D, E, as well as the calcium metabolism benefits of K2 along with the D3. So getting calcium out of areas like your arteries and getting it into areas it needs to be like your bones. When it comes to nitric oxide production, detoxing metals is very important. Some of you may be familiar with the work of Dr. Gary Gordon. He is by far the forefather, the grandfather, if you will, of IV as well as oral chelation. He has tracked millions of chelation treatment patients over the years. And but this is what he says with regards to the correlation between metal toxicity, EDTA, and nitric oxide. He says the mechanism by which EDTA affects nitric oxide levels has to do with the levels of lead that accumulate in all our tissues, and everyone today is toxic with lead. If you look at the periodic table of elements, you will see that the atomic structure of lead and zinc are directly related to each other. As we raise the levels of lead, we are actually plugging lead into key enzyme functions in our body that normally zinc would have fulfilled. Some of these enzymes are called nitric oxide synthesis. These are the key enzymes that are responsible for this job of attempting to help our body keep a healthy balance of blood flow by making nitric oxide out of the arginine and related amino acids that we get in our diet. So in short, nitric oxide synthase is important, that enzyme,